Okay, so today we're going to look at two completely different ways of thinking about addiction. On one hand, you've got the D.A.R.E program. Yeah, the one most of us probably remember from school. And on the other, there's this totally new idea from the Wounded Healers Institute. And trust me, the difference between these two could flip everything you thought you knew about addiction on its head.
So, let's just start with a big question, one that really gets to the core of this whole thing. What if everything we've been told about addiction, that it's a moral failing, a lack of willpower, what if that's just wrong? What if it's not a bad choice at all, but actually a very human response to trauma? Just let that sink in. We're going to keep coming back to that idea.
All right, here's our game plan. We'll start by putting these two views side by side. Then we'll really get into the weeds of the D.A.R.E model. And right after that, we'll explore the wounded healer paradigm. After that, we're going to zoom out a bit, look at the bigger picture, touch on the science behind a new way of healing, and finally, talk about what it really means to move from judgment to real understanding.
Okay, section 1. Let's really set the stage here, because what we're talking about isn't just two different school programs. Nope. This is a clash of two totally opposite philosophies. It really boils down to this: fear versus understanding. This chart really lays it all out nice and clear. I mean, look at the difference. D.A.R.E says addiction is a moral failing and it's all about the drug itself. But then you have the Wounded Healers Institute, or WHI, and they're saying, hold on, it's a response to trauma. The focus completely shifts from the substance to the person's inner pain. It's like they're looking at two completely different problems, right?
All right, let's dive into the one we all know, D.A.R.E. And to really get what D.A.R.E is all about, you've got to understand where it came from. It was born right out of the whole war on drugs era.
So, the philosophy behind D.A.R.E. It's actually super simple. It all boils down to one thing: addiction is just a bad choice. That's it. The whole idea is, if you just scare kids enough and give them the facts, they'll make the logical choice to just say no.
And the way they taught this stuff, well, it totally reflects that philosophy. It's very top-down, very external. The source material calls it left-brain quantitative dominance, which is a fancy way of saying it's all about numbers, facts, and authority figures, usually police officers, telling you what's what. It's a one-size-fits-all approach focused on telling kids what to do, but it never really asks the question of why someone might feel the need to use drugs in the first place.
So, here's the million-dollar question. Did any of it actually work? Well, the data is in, and it's pretty damning. A huge analysis by the National Institute of Justice found that D.A.R.E had basically zero effect on drug use. Little to none. And when you think about it, it kind of makes sense. You're trying to solve a really complex internal human problem with a simple external order. It just doesn't connect.
Okay, so now let's do a complete 180. We're going to talk about the wounded healer paradigm. And this isn't just a small change from D.A.R.E. I mean, this approach flips the entire thing on its head.
The whole foundation of the wounded healer idea rests on something called the addiction as dissociation model. Now, what does that mean? It suggests that addiction isn't a choice, it's a dissociative state. And dissociation is basically when your mind checks out to escape something that's too painful to feel. It's a mental escape hatch. And this model connects that escape directly to unresolved trauma.
And this, right here, is the night and day difference. D.A.R.E looks at someone and sees a bad choice. The WHI model looks at the same person and sees a normal human response to an abnormal traumatic experience. The addiction isn't the problem, it's the attempted solution. It's a way to cope with the echo of something terrible that happened.
So naturally, the methods are the total opposite of D.A.R.E.'s. It's all internal. The source calls it right-brain holistic logic. A big part of it is embodied healing, this idea that our trauma isn't just a bad memory, it's literally stored in our bodies. In our tense shoulders, in our shallow breathing. The whole point is to figure out the deep why. Why do you feel the need to escape? And that doesn't just mean escaping with drugs. It could be escaping into workaholism or perfectionism, these so-called positive addictions.
And that brings us to a really important word: transdiagnostic. Trans means across, diagnostic means diagnosis. So it's an approach that cuts across different diagnoses. The WHI model says the root issue, the trauma, the dissociation, isn't just behind drug addiction. It can be behind anxiety, depression, eating disorders, you name it. It's looking for the one root that's feeding all these different branches.
Okay, so we've got our two models on the table, but now we need to zoom out, because this isn't just about one failed program. It's about a whole system that seems, well, addicted to failure.
And this is where you can really see how the war on drugs and D.A.R.E are cut from the same cloth. They both operate on this fundamental belief that you can solve messy, complicated human problems with force, authority, and fear. At the end of the day, it's about control, not compassion.
So you gotta ask, why do we stick with this fear-based stuff if it doesn't work? Well, the source material has a pretty bold answer. It claims the systems themselves, we're talking law, medicine, education, they're the ones that are addicted. Not to a drug, but addicted to the way things are. Addicted to the illusion of control that these old, failing ideas give them, even when all the science says it's time to change.
And that leads us right into the science, because this is where you see the biggest clash between the old way of thinking and the new evidence that's emerging, especially when we talk about certain healing plants.
I mean, look at this. This is the whole conflict right here. On one side, you have the law, which basically says these things are dangerous and need to be locked down. The source actually calls this an emotionally immature position. But then on the other side, you have pharmacology, the actual science, which sees them as healing plants with a really, really low risk of addiction. It's a total disconnect.
So how in the world do these plants actually work? It's not some kind of magic. It's just brain chemistry. The easiest way to think about it is like a key and a lock. The molecules in plants like psilocybin are shaped a lot like serotonin, a chemical we all have. So they fit perfectly into these little serotonin locks in our brain. When they turn that key, it kind of shakes things up. It loosens up those rigid, stuck patterns of thinking that we all get into. And in that moment of flexibility, it creates a window, a chance to look at old painful memories from a totally new angle, without all the fear attached.
All right, this brings us to our final point, where we're going to tie all of this together. Because what this is really all about is a huge fundamental shift, a move away from judgment and towards real, genuine understanding.
And here it is. This is the absolute core of the shift. Instead of teaching people to be afraid of something out there, a drug, this new way of thinking teaches us to be curious about what's going on in here, inside our own minds and bodies. It's about moving from trying to scare people away from something to empowering them with self-knowledge.
You know, there's a quote from the source material that just says it all perfectly. It says this whole new approach moves the conversation from "why did you do that?" to "what happened to you?" And just think about that for a second. One is a question of blame. The other is a question of compassion. It's a world of difference.
And that really leaves us with one last big question to think about. What if our entire society, our schools, our courts, our doctors' offices, what if they all learned to stop asking, "Why'd you do that?" and started asking, "What happened to you?" Could we actually build a society of wounded healers? A place where we use our own experiences of healing to then help others heal too? It's a pretty powerful idea to leave you with. Thanks so much for joining me for this one.